Hello and welcome to another edition of On the Field with. I have the pleasure of being on the field with Dr. Robert Gringmuth. He's the chair of the Medical Advisory Board at Ontario Soccer, director of sports centers, and clinical director at the sports centers here at OSA. He was my professor at school, and he's a clinical education professor at the CMCC. I had the pleasure of being a student of his while I was going through my education, and currently he's a medical lead for Ontario Soccer. Doc has been around Ontario Soccer as long as anybody can remember the original soccer doc in Ontario. There's nobody aside from the doc when it comes to this, and he's had lots of players come to his clinic here, such as Paul Stalteri. There you see him, Chris Posty, who used to be an ex-teammate of mine in high school, and I still say he was the second best player on that team, not after me, but after somebody else. And he's done lots of work with international competitions that come to town here. There you see him with Totti. I think that was with AS Roma came to town, Doc.
That's fair.
Yeah. So, Doc, maybe just give a quick introduction and tell us how you got involved in soccer, and we'll go from there.
Well, I've been involved in soccer for, I guess now 25 years, and originally started with the Toronto Blizzard. Toronto Blizzard inherited me when they bought up one of the second division teams that I was with, and I was with them for 7 years until the league folded. At that point, I switched over to the Toronto Lynx, and they've been around until TFC started. Started with the TFC as well initially. Did all the physicals here at the clinic, but with my work with Ontario Soccer and Canadian Soccer, it just became a bit too much, and so I decided to devote my time to Ontario and Canadian Soccer.
Can you describe your role with Ontario Soccer and with the Canadian national program?
Yeah, with Ontario Soccer, I look after all the injuries that are brought to our attention with the provincial teams, and I oversee the medical care for the provincial teams when they're doing the trials and the training and the games. With Canadian Soccer, I've traveled with U20 Team Canada to Europe on a number of times. Providing the healthcare for the players, and when the teams are in the vicinity of the Ontario Soccer Centre, then I've looked after the various teams that are here as well, including the women's national team.
So, Doc, obviously you've seen a ton of soccer injuries, and dealing with youth elite athletes is very complicated. So maybe we'll start generally. There's going to be some specific cases that we'll talk about, but maybe discuss generally the difficulties dealing with elite athletes in terms of diagnosis, management, and rehab, because they're very different compared to, let's say, an average everyday athlete or somebody who's a weekend warrior. Dealing with these elite athletes requires a lot of attention and proper workup. So maybe discuss the challenges that you face when you're working with these athletes.
Well, dealing with elite athletes, you're always in a time constraint. They want everything done yesterday, which is understandable because they're obviously getting paid to play if they're professional. I mean, if they're in provincial or national, obviously that's amateur. But again, the motivation to recover quickly and get back on the field to retain their spot on the team is very high. And so, again, there's a huge time commitment where we try to facilitate things as quickly as possible.
Can you discuss a little more about the difficulties in terms of diagnosing youth athletic injuries, especially the importance of using objective imaging tools such as diagnostic ultrasound or MRIs, because some of these things could be missed and then have players who get mismanaged as a result?
Well, I think most people understand that it takes time to order tests and to have players assessed, say with MRI or CT or diagnostic ultrasound or even just X-ray, because the typical mechanism is to have them referred to a family doctor or sports doctor, such as myself, and then have them sent to the lab, and then takes a few days to get the results from the lab. So we've managed to set up a network with the local labs and hospitals to facilitate that, to make it a bit quicker so we can get results faster for the national team and the provincial teams.
So what are some of the dangers of working in the dark when it comes to diagnosing and treating elite athletes?
I prefer to know exactly what I'm dealing with when an athlete comes in with an injury. I don't like to guess, especially when they have trials coming up abroad, say in Europe or in South America, and it doesn't make sense to be working on an assumption when you're not fully sure of how serious an injury is. So having lab testing available immediately is far superior to delaying things. And that, of course, affects the timelines, how long it'll take for an athlete to get better.
So maybe we talk about some timelines generally. So when we're talking about, let's say, a muscle strain that's very commonly seen in a soccer athlete, what is the timeline in terms of from day of injury to fully returning to full play?
So typically with just a strain, it may take 2 to 4 weeks to get better. It may take less. If it's a minor, very minor strain, it might only take a week. And it also depends on the condition of the athlete. If they're, say, dehydrated or if they're having poor nutritional habits, then it can obviously take longer because the body doesn't have the resources to recover properly. But if it's a more severe injury, like a class 3 or a type 3 strain where there's an actual tear, you're most likely looking at 4 weeks to 6 weeks, maybe 8 weeks. And so we use diagnostic testing to our physicians here to be able to determine the extent of healing incrementally throughout the healing process.
And the 4 to 6 weeks that we're talking about, that includes the sideline training and mimicking game conditions prior to returning to play?
Sideline training and all that, and doing mock games and whatnot, that's something that we institute once we know that the tissue has healed. So at that point, we're looking at reintroducing things like improving their reflexes, improving their proprioception when they're, and trying to recapture some of the skills that they have just as a soccer player, where you've got the neurological mind over body type mechanisms.
Absolutely. Yeah. So a lot of injuries. So we're going to talk about maybe 3 specific ones: groin injuries, meniscus injuries, and then back injuries, which are very common in soccer players. Starting with groin injuries, maybe talk about how they usually present when you see them at the clinic with soccer players or any type of athlete usually, and then what is the process of diagnosing and managing groin injuries? Because I've personally had groin injuries going through my playing days, and I didn't take care of them, and they kind of ossified over the years. There's a condition called myositis ossificans where the muscle actually calcifies, and you've seen my x-rays. I have chunks of bone in my groin. So it's a very common injury that when mismanaged could essentially end your playing days. So maybe talk about groin injuries a little bit.
Okay, so groin injuries, you've got various, as you mentioned, degrees of groin injury. But not only that, many things can present as a groin injury, and this is something that everyone needs to keep in mind when you're doing an assessment on someone with a groin injury. It could be the groin. It could also be microtrauma to the pelvic bones, or it could be a hip problem, hip pathology, or even a pelvic internal problem. So, I mean, these things need to be differentiated before you begin treatment. I've seen all too often therapists providing treatment for 6 weeks for what they thought was a groin injury. When you do the MRI, you realize there's actually fracture of the pelvis or various other things that just don't show up on your plain X-rays. So yeah, this is the biggest thing you need to keep in mind when someone presents with a groin injury. And you were unfortunate enough to have a chronic groin injury and ended up with deposits.
Absolutely, and they hurt now when you run around a little bit. You also see a lot of cases where even testicular cancer could present as growing pain, and sometimes that's even missed, or as you said, visceral pathology such as, let's say, urinary or bladder infection sometimes can present at groin injury. So a thorough assessment is very, very key when it comes to these things. What is the management of groin injuries? Because you can't push groin strains very quickly. They will really cause you issues. So what is the timeline usually when you're dealing with these, and what is the progression in terms of getting back to play?
So keeping in mind that groin is just the general terminology. So if it's a tendonitis or a tendon tear in the groin area, then that could take up to 8 weeks to recover. Again, you're having your physicians do lab testing to determine what state of healing the player is at incrementally. And if it's, however, something to do with the pelvis, you could be looking at 6 months of recovery. And sometimes that means doing absolutely nothing. Where they can't do any weight training that affects that area. They can't run, they can't jog. Because if they continue to do that, then they're just they're going to have even more serious pelvic bone injuries as they ignore their condition. And although things like pelvic visceral things are outside my scope of practice, we have a full team of physicians that we consult with that are on site, and this helps facilitate the management of the athlete.
Interesting you mentioned that. I remember one of the provincial players when I was on the national program had a groin injury that initially even didn't show up on a diagnostic ultrasound, and this kept bothering him, bothering him. And I remember eventually we sent him for an MRI, and it was on the MRI that was able to show that it was a tiny tear of the attachment part of the psoas tendon attaching to a lesser tuberosity of the femur there. I don't know if you remember this case, but yeah, this is one of those interesting cases because sometimes even with diagnostic ultrasound, you could miss something that's a deeper structure in the thigh or in the groin region.
That's true. All the different types of lab testing, from my understanding, have limitations, and so that's why there's such a large array of different tests that can be performed. And again, our team of physicians here, they're the ones who are responsible for ordering those tests.
You talked about pelvis injuries that mimic groin type of strains. Can you give a specific case if you remember?
Yeah, I've managed a number where there's stress fractures in the pubic ramus, which is the bony part of the pelvis. Also, sometimes there's fractures within the pubic symphysis due to the attachment of the abdominal muscles. And so this is another thing that needs to be differentiated, which I didn't mention earlier, is abdominal muscle strains that are down in that area. And again, as I said, that groin injuries are more of a general term, which encompass different types of injuries.
How did these pelvic fractures came about? What was the mechanism of injury for these?
It could be from overtraining. So the player could have been too exhausted with the next training session and not recovered fully. It can be a tendency if you have a goal where you're trying to be at a trial where there's coaches looking at you and looking at your performance and you're working too hard. It could be personal trainers that are pushing you too much, not understanding the full impact of not being able to recover. I mean, typically you should have recovery times, recovery days, and some of that could actually be part of your training that day, but a recovery training.
Can you describe what you mean by recovery day? So typically, what would
take a day off during the week, or you could alternate your sessions so that you're not training every day, but maybe you have 3 or 4 days of training, and then you take 2 or 3 days off. On the other hand, if you really feel you can't take any days off, then there are recovery training sessions that you can do where it's just low impact training, and really what you're trying to do is improve blood supply to your body and not overstress the ligaments and joints.
So you see a lot of times when a player has a strain of one of the adductors, the groin muscles, a lot of therapists will jump in very aggressively early on in the acute phase, so the first 2 weeks or even subacute phase, and they start manually treating it, such as doing deep tissue massage or active release on it. What are your views on that?
Well, I mean, it could be appropriate if there was no tear or any other type of underlying pathology that would prevent you from doing that. But, I mean, from my perspective, we make sure that we know what the condition is and what the actual diagnosis is. So we try to avoid jumping in before we know what we're dealing with.
This reminds me of the case when we were in clinic where we had the gentleman who was working at Woodbine Racetrack, and he had been back heeled by a horse in the thigh, and he had a major contusion, and one of the therapists that he had seen had done a lot of manual therapy on it, and that muscle had turned into calcium by then time he showed up there, and we tried to reduce that. So those are some of the dangers of doing too early aggressive work on a tear or a tendon injury that hasn't healed yet.
Yes, that would be my opinion.
So let's move on to the next commonly seen injury in soccer, meniscus injuries. There's different types, obviously, as you see on the picture, and there's different ways of dealing with this. Let me discuss briefly your experience with diagnosing these type of injuries and then how you go about dealing with them.
Okay, I see many athletes with soccer players with meniscal injuries. The meniscal injuries, there are times where they can heal on their own, depending on the age of the player, depending on the location of the the lesion in the meniscus. So you really need to, again, make sure that the physicians are ordering the proper tests so you know what you're dealing with exactly. And that'll give you the opportunity to give an accurate prognosis as to how long it will take to heal. So initially, we typically use like passive therapy, and if it's appropriate. Sometimes it's not appropriate. Sometimes we just have to have the athlete rest, or sometimes they have to be referred to the surgeons required to make the corrections.
Usually post-surgery, after, let's say, doing a scope where they either clean or stitch the meniscus back, what is the timeline to return to play?
Again, it depends, because in working with professional soccer players, their motivation is their income. And so they would typically get back much quicker than the average individual. I've had players who will get back to playing within 10 days.
Wow.
But again, it depends on where the lesion was in the meniscus and how dramatically it would affect the biomechanics when they're back into the soccer game. Whereas the average individual post-surgical, I would say probably be about 4 to 8 weeks.
4 to 8 weeks. Yeah. And the types of tears that are not too extensive, they respond well to conservative care, so doing functional rehab?
They can. Depends again where the lesion is. If it's in, as I'm not sure if you're aware of it, but I mean, there's the 3 zones: the red zone, the pink zone, and the white zone. And it's named after the amount of blood supply that it has. And the part that's red, of course, is the more superficial one. So if it's in that area and the athlete's only in their late teens, it's a good chance they'll heal with just therapy. But if they're 40, 50 years old and it's in that zone, likely it's not going to heal too well.
Yeah.
So they're better candidates for having corrections made by the orthopedic specialists.
Next, this is an interesting injury. Back pain seems to be the #1 complaint for soccer players, according to FIFA, aside from acute injuries. So aside from muscle strains and common injuries that are picked up, back pain seems to be the #1 complaint for soccer players. And some of it's sometimes related to just tightness in the lower limb musculature and tightness in the muscles of the core. But there's other pathologies that usually are found when you're dealing with younger elite athletes. What has been your experience? Maybe we'll discuss some of these common injuries here.
Well, I see in the picture here you've got a player with a fracture in the spine and some slippage of his vertebra, typically called spondylolisthesis, with a pars defect. And I mean, in the past, we used to think that this occurred when they were younger, in their, say, the first 10 years of their life where this developed. But now we're realizing that it can happen in athletes. And so certain lab testings, like our physicians would send them for a CT scan to determine if it's an active fracture or if it's a old fracture. And probably about 5% of the population will have this type of a lesion in their lower back. So from a medical perspective, from my clinical understanding, is we would determine if it's active or it's not active. If it's active, then we know that there's healing potential. And then you might use 2 schools of thought. One school is that they get braced, which would be what our physicians would do, or they would not get braced, but they couldn't do anything either, so they'd be taken out of the game. And of course, the other thing would be if it's an older type fracture, they would probably respond quicker. And again, in the long run, though, it's very difficult to heal these. If they don't heal, then they're going to experience difficulty with their low back pain from time to time, unpredictably, and something we need to tell them.
Are they able to return to playing at any point?
Yeah, they can return to play once the inflammation and the pain has settled down.
What other types of back pain do you usually see in soccer players?
We see things like you had mentioned earlier, like strains of the muscles. Sometimes, though, soccer players will neglect their core, which is hard to believe, but I see it quite often. It's not like it's an epidemic or anything, but sometimes with weak core muscles, then they start having pain and strains in the low back and in the lower abdominal muscles. I mean, there are different thoughts on how to strengthen your core. We've got McGill's type exercises, but those were designed for the middle class worker, not for high-end athletes. Yeah. And then there's other exercises, such as the bunkie exercises from South Africa, which are a much more challenging type exercise and much better for an athlete.
Absolutely. So Doc, we'll finish with this, the importance of gradual return, because usually I have a hard time getting this point across to the players and to coaches and their parents in terms of why is it important to take some time, because this is an interesting chart, because if you're over aggressive as a therapist, then you get chronic injury and reaggravation of that injury. But if you're too conservative, the player misses too long of a time. So how do you go about explaining the importance of gradual return, gradual loading of tissue before going back to full play?
Well, this is why I had said earlier, we use our physicians to order the test required for us to know what state the pathology is at. So if the pathology is not healed yet, say a tear has not fully healed, there's still partial tear, and then we won't allow the athlete to go back to play or go back to training. If it's fully healed, then we'll transition them onto what we call field training, where one of our therapists who also has coaching background will work with them on the field and make sure that they're capable of doing all the drills required without re-aggravating their condition. Because when you send a player back to their team right away, the coaches or their strength conditioning coaches, they don't always have the time to deal with individual players. They're dealing with the team, and so we feel it's our responsibility to make sure that they're capable of really being completely reintegrated with their team.
So, what was your most memorable, we'll finish with this, what was your most memorable soccer injury? Because you've seen tons by now. You've seen some very dangerous one. I remember there was a heart condition on the field where the player was out, and eventually I don't know how they ended up, but that was a serious one. But maybe give us your top 3 most memorable, or if you want, just top memorable injury of all time.
Okay, I think probably the worst injury I've seen is where one of our goalies ended up having his testicle chopped in half because the opponent player kneed him right into the groin, got caught between the pelvis and the knee and the bony pelvis. So that's the worst one. Other than that, it's fractures where athletes have ended up fracturing both the lower limb bones, the fibula and tibia, and there's other things like rib fractures. I've had a few facial fractures where someone's been elbowed in the face and the bone's been indented. So these are things that end up having to be managed in a team fashion, not just by me.
So the testicular tear, obviously you just taped them and send them back out again?
No, he was under surgery within 6 hours in the hospital.
No kidding, that's a very serious injury. So, Doc, thank you very much for taking the time. Dr. Robert Gringmuth from the Sports Centers here at Ontario Soccer Association, and I'm happy to announce that Kinesis has become a satellite clinic for the Sports Centers now. So we're happy to be able to collaborate with Dr. Gringmuth and his staff here at Ontario Soccer. And of course, I hope you don't need us, but if you are injured, contact us either at the Sports Centers or at Kinesis School. We'll be happy to take care of you. Doc, thank you very much for taking the time.
All right, thank you very much.
Have a good one.
All right.
Stop.
Oh, that was good.